You can start, ma'am.
Yeah. Hello, friends. This is Dr. Jigna Tamagond. I am consultant and fertility specialist at Oasis Fertility Karimnagar. Today in this Facebook live session, I want to discuss with you a very challenging decision which many couples have to take, whether to go for IUI or IVF, which is the best one for you. So, this journey to parenthood, what we see is it's a very long journey for many couples. Not everybody is really lucky that they conceive and they enjoy this parenthood journey. But some of the couples are facing this problem where they are unable to conceive very soon. In fact, it is seen that the problem now is like the tip of iceberg. What we see up is not the reality. Almost 1 in 10 women face this challenge. And it may be because of the male partner, it may be because of the female partner, and in many cases, it is a combined. Both the male and the female are having certain trouble. So, generally, when you go to your gynecologist or when you go to your infertility specialist, they will evaluate you for everything. Like they will check what is wrong with you, they will do certain blood work, they will do an ultrasound for the female and a basic semen analysis for the male. And based on your reports, the doctor will suggest you to go for treatments. So, what are the treatment options that are generally given to patients? So, the treatment options that are generally given are basically categorized into three main things. One is ovulation induction and timed intercourse, wherein your ovaries are stimulated to produce an egg follicle, and timed intercourse is suggested when the time for ovulation arrives. The second is the IUI or the intrauterine insemination, and the third is IVF or the ICSI procedure, in vitro fertilization. So, patients who need timed intercourse are pretty straightforward. They have everything basically more or less in the normal parameters, and they just need minimal assistance to conceive. But the decision to decide whether you need IUI or IVF is the one which is tricky. So let's get into who will benefit with IUI and who will benefit with IVF. So, what is an IUI procedure? So, basically, an IUI refers to an intrauterine insemination. It is a process wherein the sperms are cleaned, processed, and they are directly placed into the uterine cavity. Now, this increases the odds of conception by reducing the distance that the sperm need to travel from the vagina right up till the uterus, inside the uterus, and into the tube. So, this may be a little confusing to you. I would just like to explain it to you with a diagram of the uterus. So, if we take a cut section of the uterus, this is how it looks: the uterus, the tubes, and the ovaries. So, normally, if a pregnancy has to happen, if a woman is ovulating regularly, that means she is having regular cycles, somewhere around the 12th to the 14th day, her egg is ready. By egg, we mean a microscopic structure, or the oocyte is a microscopic structure which cannot be seen on scan or even in any other ways. So, based on the cyclical pattern that a woman is going through, her oocyte is expected to be ready somewhere between 12th to 14th day. So when the oocyte is ready, it is picked up once she ovulates. It is picked up by the tube in a very intricate manner, wherein the tube has suction movements and it brings the oocyte very close to the uterine cavity. So during this time, when a couple has sexual activity, the sperms travel up from the vagina through the cervix. The cervix is referred to as the mouth of the uterus. So they travel up through the cervix and enter the uterine cavity, and they meet the oocyte in the tube. They make the egg in the tube. So the first process of the baby is formed right in the tube. The baby or the embryo grows for 2 to 3 days in the tube and then comes and implants into the uterine cavity. So what we are trying to do in IUI is we are reducing the work for the sperms. So the distance which the sperm needs to travel, from the vagina into the uterine cavity is bypassed. So we are putting the sperms directly into the uterine cavity. So this is what happens. The sperms are processed, and active motile sperms are in a concentrated form of just zero point 0.3 to zero point 0.5 microliter are placed inside the sperm, inside the uterine cavity. Now, who are the patients who can benefit from IUI? So, IUI is generally suggested to patients who are having unexplained infertility. That is, you say all your investigations have turned out to be normal, everything seems to be fine, but still you're not conceiving. So, for such patients, IUI is a beneficial thing because very often there may be some factors in the cervix. Cervix refers to the mouth of the uterus. There could be some thick mucus, or there could be some kind of anatomical problem in the cervix wherein the sperm is unable to cross through it and reach the uterine cavity. So the IUI procedure helps such kind of patients who are having mild endometriosis. Now, endometriosis, I'm sure many of you might be knowing, is a very common condition these days wherein patients are having the endometrium or the uterine lining like deposits in other parts of the pelvis also. So, mild cases, those who are having very mild form of endometriosis, such patients can benefit from IUI. Male partners, if they are having very low sperm motility, so this is referred to as asthenozoospermia. So if males are having low motility of the sperm, so in sperms we are looking into what is the number of count of the sperm, what is the motility of the sperms, and what is the morphology of the sperms. So those who are having problem majorly with the motility, they will be benefited best by IUI. So the other thing, like I told you, if they are having some issue in the cervix of the uterus, cervix is the mouth of the uterus. So if, like I discussed, if they have any problems, anatomical or functional problems of the cervix, that in such cases IUI will be useful. The other kind of people who can benefit with IUI is those who are having some kind of sexual dysfunction. So many males may have problems with erection and ejaculation, and they are unable to perform the sexual activity for whatever reason. Such patients, apart from undergoing treatment for the same condition, for the purpose of having a pregnancy, they can go for IUI. And sexual dysfunction need not be only to males. Generally we consider that it's only the males who are having this sexual dysfunction problem, only they may have issues, but there are certain women also who are unable to have sexual activity because of vaginismus. That is another condition wherein the uh, wife is unable to allow for sexual activity because of pain. So, so such patients can also benefit with IUI. The other, there can be certain specific circumstances wherein a donor insemination is required, wherein the husband may not have adequate count or zero count, or in certain scenarios, if they don't want to pass out some genetic diseases into their family, such conditions the donor insemination can be advised. But believe me, friends, nowadays we also have treatment for those who are having zero count, so it's not impossible for husbands with zero count also to conceive. Now, how does this IUI actually beat infertility? So we have been talking about IUI, these people should go for IUI, but what does IUI actually do? So basically, what we are trying to do here is we are making sure that the egg is developing, it is ovulating, and we are timing up the correct time when we are placing the sperms inside. So the whole process, which happens very much naturally in our body, is not so the case in many women, or because of the male factor. We are trying to, you know, optimize both of them. Make sure that the ovulation egg is released on time, and at the same time we are putting sperms inside so that we are giving them optimum time to interact with each other to form an embryo. So does IUI help everyone? Definitely, the answer is no. So, like I discussed with you, there are certain fixed criterias for which the IUI can be helpful, and there are certain patients who can definitely not benefit with IUI. So, who do not benefit with IUI is another question. So, you need to identify whether you fall into this category or no very carefully. So, women who are having moderate to severe endometriosis, like I discussed, endometriosis can be of three types: mild, moderate, and severe. So, in mild condition, generally the anatomy of the whole uterus, that is the uterus, the tubes, and ovaries, are not much disturbed. So those patients easily conceive with IUI. Their tubes are also expected to be patent. Another thing is, if they are having severe endometriosis or moderate endometriosis where their anatomy of the whole, the position of the uterus, the ovaries and tubes is disturbed, then in such a case they are not going to benefit with IUI. Those women who are having blocked fallopian tubes. So, like I told you, the whole purpose of doing IUI is to give the sperms closer to the eggs, which is ready in the tube. So, if the tube is already blocked, it's not going to help you to conceive with an IUI. If women have severe fallopian tube disease, like there could be certain women who are having severe pelvic inflammatory disease, repeated infections. So if you are had repeated white discharge and all, please get yourself checked, because that is a reason which may affect your tubes, and your tubes may be blocked. You may be trying to conceive, but if your tubes are blocked because of infections which you've been having in the past, then it is going to be difficult for you to conceive. Men who are having very low sperm count. So generally, IUI is more successful for patients who have a count about 10 million. People between 7 to 8 million can go for an IUI trial in a very guarded manner, provided everything else is in their favor. But those who are having count less than 5 million, it is generally difficult for them to conceive with an IUI. And people who are having very low count, less than 1 and 2 million, they are not the right candidates for IUI. Those who have had 3 to 4 attempts of failed IUI. Now, generally, after 3 to 4 attempts of IUI, if you haven't conceived, definitely there is something which is not in your favor, which is not letting the wife to conceive. So it is not going to really help you, if you keep on trying more and more attempts of IUI. Now, what do you expect? Now, we discussed so much about IUI. Now, like, suppose you have decided to go for an IUI treatment. What is this? What is it that you are going to expect when you go for an IUI treatment? Believe me, friends, it's not a very painful procedure. IUI is the most least invasive, and it is a very painless procedure. And sometimes you may not need so much of medications also. A natural cycle IUI can also be attempted. IUI can also be combined with ovarian stimulation. That is, there are certain drugs or tablets and injections in a very milder dose can be given to make more and more of follicles to grow. Generally, the target to grow follicles is 2 to 3 follicles, that is the eggs to be grown and mature. So I just would like to summarize this whole IUI, how the whole procedure happens to you. On day two, that is day two of your menses or your period, when you visit your doctor is going to do a transvaginal ultrasonography for you to check whether your uterus, everything is in place, your endometrial lining is completely shed, your ovaries are looking normal, and to check if there's any kind of cyst in your ovary. Because if there is a cyst, the chances of you to conceive with an IUI or your response to medicines may not be very optimum. Then, once everything seems okay, the medicines are started. Generally, tablets and milder doses of injections may be suggested to you. Follow up scan is done on the ninth or the 10th day to see if your egg is developing or no. And once it reaches an optimum size, which generally happens at around the 14th to 15th day. Now, and telling you 14 to 15 day doesn't mean that everybody responds in the same way. You may get ready a little early also, maybe somewhere around 10th or 12th day, or you may take a little longer time, maybe 19, 20 days too. So it depends on how your condition is, what your response to the medications is. So once the follicle reaches the optimum size, your doctor is going to give you an injection or a trigger shot for ovulation to happen. That is, the egg to release and be ready for fertilization. So after that is given, around 36 to 40 hours of time, you are planned for a IUI procedure. So generally 36 to 40 hours is the plan for IUI. Now what is important? So all of us know. Maybe you may need not get into the intricalities of the whole procedure as such, but you need to know what exactly is expected out of you when you go for an IUI procedure. So it is ideal that when you go for an IUI procedure, your husband should have an abstinence of, at least 2 to 3 days. What I have noticed is many husbands think that, my wife is undergoing treatment, so it is better to be, not have sexual activity, but that is a very wrong concept. Okay, you can have regular sexual activity, but before the day of IUI, which your doctor will inform you, at least have 2 to 3 days of abstinence. On the day of IUI, keep your bladder partially full before the procedure. Ensure that your ID, your hospital ID, has been checked. Both your husband and your hospital and your ID has to be checked before the sample is inseminated. After insemination, it is wise that you lie down for 15 to 30, 20 minutes. And many people have this doubt, how fast can I resume sexual activity after an IUI procedure? So, generally, you can resume sexual activity in a day or so, because on the day of IUI, your husband would have given sample and the process sample is already inserted into your uterine cavity. So, next day onwards, you can resume sexual activity. In fact, most gynecologists suggest their patient to go for sexual activity for the next 2 to 3 days, and take your prescribed medications regularly, and your result will be expected in another 15 days. Now, what are the risks? So, after you have undergone IUI, many people are worried, do I have to take complete bed rest? And also, that is not really recommended. You can resume your physical activity. No kind of bed rest is really necessary for after an IUI procedure. Of course, you got to be cautious. Don't bend too much. Don't lift heavy weights and all. But absolutely, best bed rest is not recommended. Small risk of infection during IUI is there, but that risk generally is taken care of by the doctor, because all aseptic precautions are taken to perform the procedure. Little risk of multiple pregnancies can be there. That is, if you have developed more than one egg. Generally, we try to see to it that you develop only 2 to 3 eggs, so that 90% of the times a singleton pregnancy is what we desire. But once in a while, around 5 to 10% of chance may be there wherein you may have twins, and a very rare chance of triplets. Some patients, because of the medications that are prescribed for ovulation induction, may have OHSs, which is a condition wherein the ovaries hyperstimulate. In such a scenario, generally we do not prefer to do an IUI. We would prefer to cancel the cycle, because if the ovaries develop too many follicles, there is a likelihood risk that the wife will have pain, and the risk of ovaries being tossed. Now, what is the success rate of IUI? So, all of you, now you saw that, who are the candidates who should undergo IUI, how it is to be done, and what are the, risks that are associated with it. Who is the best person to do it? Now, what is the success rate of IUI? Now, every couple will have different responses to IUI, and there are many predictors on which the success rate depends. It's the age, it depends on what the underlying infertility diagnosis is there, what are the kind of drugs that are used, what are the outcomes, and also depends on your duration of marriage. In any case, the most important factor definitely is the age. So, on an average, the IUI success rate is somewhere between 15 to 20%. Okay. How many IUIs can be done? This is another question which many of my patients ask me. How many times, doctor, can I try for an IUI? Now, like I already mentioned to you, if you've had IUI for 2 to 3 cycles and you have still not conceived, that means there is something going wrong inside which we are not able to pick up on any kind of investigations or any kind of ultrasound. So the best solution, if you have already had 2 to 3 IUI failed cycles, the next option for you is to go for IVF. Now, what is this IVF? IVF is in vitro fertilization. In vitro, in fact, means a Latin word which means glass. So basically, the baby or the embryo is cultured in a glass or in petri dish outside the body in a lab. Okay, so that refers to in vitro fertilization, and we are lucky that in IVF and ART technology has advanced to such a great extent that we can also identify genetic disorders in the embryo which has developed and identify the best embryo, the most healthy embryo for implantation. So, IVF is a treatment in which a female patient's eggs are surgically removed outside her body. Surgically, by surgically, I don't mean that we are going to cut open her abdomen and remove the eggs. No. This is a very minimally invasive procedure wherein, through an ultrasound guidance, we are removing the eggs from the vagina itself and we are injecting the sperm inside the egg, looking under high microscope magnification and preparing the embryos. And once the embryos are ready, we are placing them back into the uterine cavity for implantation to happen. So, this is IVF in a nutshell. So this is the picture showing you an oocyte, in which a sperm is being injected. Okay, all this happens under the microscope under very high magnification. And after 5 days, this is the beautiful blastocyst, okay, or the embryo which is developed, which is going to develop into a baby once we implant it into the uterus of the wife. Now, when should you consider IVF? When is it time for you to decide that yes, IVF is the best solution for me to achieve my parenthood dream at the earliest? Now, if you have blocked tubes, like I already mentioned to you, if you have blocked tubes, IUI is not the right choice for you. IVF will help you to conceive faster. Basically, because in IVF we do not require the tubes. The whole process is that you're given hormone injections to develop more number of eggs, and once the eggs are ready and ready to mature, they are removed outside the body. The sperms are injected into the eggs, the embryos are formed, and then the embryos are placed back into the uterus. So know where the tube comes into place. In moderate to severe endometriosis, like I told you, moderate to severe endometriosis patients, the earlier they take up the IVF option, the better, because the endometriosis is a very progressive disease. Many of my patients think that okay, if I undergo laparoscopic surgery, my endometriosis is going to be all right, and now I can conceive even naturally. So, what I want to tell such patients is endometriosis is a progressive disease. Laparoscopy gives us some time, to plan and give you treatment, but it doesn't stop there. After some time, if you give time, many times patients have endometriotic cyst, or it is called chocolate cyst. They undergo laparoscopy to remove the cyst, and after 6 months, when they come back, there is another cyst formed. So that time they are always in shock. Doctor, I already underwent laparoscopy. Now how is it that I have a cyst again? So that's what I want to tell you is that endometriosis is a progressive condition. It's not going to stop with any kind of treatment that you take. Definitely the disease process may, be stunted with our medications and injections, but it's not going to stop there. If you have any genetic disorders running in the family, so nowadays we have this new technology called as PGTA, that is pre-implantation genetic testing of the embryos. So like I mentioned to you, if the embryos are ready, we can also do genetic test on the embryo and check if there's any kind of abnormality or any genetic disease in the embryo. We can avoid transferring that particular embryo and transfer the embryo which is totally healthy and normal. Recurrent abortions due to genetic reasons. Very often we see that patients are able to conceive. In fact, they conceive every 3 months very spontaneously, but they are unable to continue the pregnancy. They are having miscarriages repeatedly. Such patients can also be benefited by IVF, wherein we can check the most healthy embryo and implant it. Husband, if the husband, like I told you previously also, if the husband is having very low count or a no count, absolute zero count also, there are different technologies nowadays wherein we can identify, do a micro TC, that means try to take out the sperm from the testis directly, In fact, we are having microscopes to identify the tubes which may contain the sperms and remove the sperms. So that intricate technologies are now available for you to take, enjoy and take the benefits. If you are married for a very long duration, okay, and you have already tried multiple treatments, now what I want to, inform you people here is that the ovarian reserve or the egg reserve of women is limited. Not all women can be fertile throughout their life. In fact, nowadays in the present scenario where the lifestyle factors, stress, so much of pressure is there everywhere, the ovaries, what we see is that the females are having very less number of eggs these days. So that egg reserve is going to decline over time, and believe me, there is no magic drug or no magic treatment to improve your ovarian reserve. So when you're having good or sufficient ovarian reserve, it is better if you have already tried multiple treatments. It's better you not waste time and go for IVF treatment, because the eggs which are there can be utilized for IVF and help you achieve your pregnancy dream. Another thing is if you're a cancer patient. In fact, having a baby is everybody's dream, whatever condition or scenario you are in. So, if you are a cancer patient and you are supposed to undergo chemotherapy or radiotherapy for whatever reason required, chemotherapy and radiotherapy are known to damage the genital organs, be it the sperms or be it the eggs. So, in such a scenario, those who are going to go for a treatment, I suggest you go for a fertility preservation option. That is, you can go for IVF and freeze your eggs for the women, and the males can also consider to freeze their semen so that it can be utilized later for your fertility options. Now, we already discussed how IUI beats for infertility. So, how does IVF beat infertility? So, many women have this condition where they are unable to conceive because of ovulatory problems. They are unable to ovulate properly in spite of the drugs or injections they are taking. So, for such patients, IVF is a very good option wherein more number of eggs can be produced with different dosages of hormones. Tubal issues, like we told, we are bypassing the tubes. So for that reason, we are putting a ready embryo into a uterine cavity. In patients who are having semen problems, ICSI is a procedure that is being done, that is intracytoplasmic sperm injection, wherein we are going to, bypass the process of sperm and egg to fuse on its own. And, very often what happens is that there can be fertilization failure. Although we are putting the egg and the sperm together, they may not be able to fertilize because of many reasons. So when we are injecting the sperm inside the egg, we are making sure that it fertilizes. In cases like where there is miscarriage, like I already told you, such patients also will benefit with IVF. And another thing I always tell my patients that it gives me an opportunity to identify what's going wrong with you. When you are going through such a long journey, when you're going through so much, it's so much of a stress, not only financial, even mental stress that you're going through. You're always looking for answers. You're always wanting to know that why isn't it happening. So IVF is also going to tell us that why things are not working out with you. There could be issues with your, oocyte quality or with the implantation of the embryo inside your uterus. So IVF gives us a chance to identify what really is wrong, and it gives us the power to correct it so that we can give you the chance to conceive faster. Now, how is the IVF process actually? So, suppose now you decided that you want to go for IVF. Now, what are the things that you should be ready with, and how things are going to go for you? So IVF process is very similar to IUI. Now you can boost your fertility by taking a very healthy diet. Okay, I always tell my patients eat colorful things. You should have colorful things on your plate. Eat greens, green leafy vegetables, fruits of all colors, and also take lot of citrus fruits. Okay, and nuts. Basically, have things which are of good color: carrots, papayas, And many patients ask me, Madam, if you tell me to have papaya, no. When you're preparing, papaya is a rich source of antioxidant which you can take. After your embryo transfer, you should not take, but before that, you can have it. Okay, and all kinds of greens like tomatoes, oranges, watermelons, everything, all fruits are very rich source of antioxidants which boost your fertility. Hydrate yourself very well. 2 to 3 liters of water is a must when you're trying for a pregnancy. Even normally, for your general health, it is very necessary. And adopt some kind of holistic approach where you can calm your mind, decrease your stress levels. Then comes to the ovulation induction or the ovarian stimulation. So on the day two of your period, now you have decided you're going for IVF procedure. You will be called on the day two of your period, and after a baseline scan, the doctor is going to prescribe you injections which you have to take for next 10 to 12 days on the regulated time. You know, the hormone injections are supposed to be taken in the very accurate time and cannot be, delayed even for few minutes sometimes. During this process, you will be very closely monitored. You will have follow up scans to check how your eggs, this time we are talking about more number, how many eggs we are expecting will be little higher. So we are expecting all of them to grow and mature, and once they reach an optimal size, you will be given a trigger shot. So don't worry, people. It's not going to be, very complicated thing. Many of my patients always feel that IVF is like some big surgery, and there's a lot of things that you need to go through and all. No, it's absolutely not that way. The hormone injections are there, but if you once you achieve your pregnancy and once you have your baby, are you not going to immunize your baby every now and then? In fact, you have to give every 15-20 days one immunization will be there. So think that you are facing that, so that you can have a healthy baby and start your injections. So once your follicles are ready, you go for the egg collection process. Okay, that egg collection process is done under mild sedation only. It's a daycare procedure. It can be done, and in another 5 to 6 hours, if you're fine and you have no problems, you can be discharged from the hospital. So once the eggs are collected out of your body, that is the follicular fluid is collected. The embryologist will check for the fluid in the lab and see the oocytes, and once the oocytes are checked for, they are injected with the sperms of your husband or the partner. Then they are left for growth inside the incubator to form the embryos. And if everything seems fine, the embryos can be placed back into the uterus. Again, this embryo transfer procedure is also very, very simple, does not need any kind of anesthesia, and it is not painful at all. So the embryos can be placed back into the uterus in the same cycle, which is referred to as fresh transfer, or they can be frozen and they can be transferred later. That is called as the frozen embryo transfer. So post the embryo transfer, you will be prescribed certain medications which you have to take regularly, and after around 15 days, you will be informed for the result. Now, what are the risks of IVF? Again, the risks of IVF very similar to IUI, mainly risk of ovarian hyperstimulation because of the injectable hormones that you will receive. The number of follicles that grow may be more, but nowadays we have very good protocols and very good drugs in place, wherein the ovarian hyperstimulation has been the risk has become very negligible. And multiple pregnancy, again, the advantage of IVF here in multiple pregnancy will also be reduced to a great extent, because we can decide the number of embryos we transfer, we decide how many can be implanted, so that risk also is greatly reduced. Ectopic pregnancy, that is the risk of pregnancy being formed in the tube, is also very negligible. But yes, that is a risk to be considered. Infection, again, with all aseptic precautions that are being followed, risk is very rare. And future risk of cancer with all the hormones, many of my patients have that doubt, if madam, we are taking so many hormone injections, so many drugs, is it going to cause any kind of trouble later for me? So there are no proven studies so far which will say that these hormones can cause any kind of cancer in future. And mainly these drugs are very short lasting. They have effect only for one particular day. That's why they need to be given daily. What is the success rate? Now this is the next important question which most of my patients ask. What is the success rate of IVF? The probability of success again depends on many factors: the age, the cause of the infertility, how the semen quality was, what were the eggs, how were the quality of the eggs, and then how was the quality of the embryos that were formed. So, since there are so many determining factors, the success rate differs from patient to patient, but on an average, a worldwide success rate of 40 to 60% has been reported. Definitely. Now, how should you decide? Now, we come back to the same question. How should you decide whether you need an IUI or an IVF? So, what I would suggest, friends, is that this should be a combined decision with your doctor. Okay, you should be comfortable enough with your doctor to find out from him or her as to which is the best suited treatment for you. Understand the pros and cons of each treatment, and what you should consider is that time to pregnancy matters a lot. It doesn't mean that you start treatment and you go on trying treatments, thinking what is going to work, something. See, it is important that you have hope, but every hope that you get disappointed matters, brings down your spirit. And also, you need to remember that one size does not fit all. So, every patient cannot be suggested an IUI, or every patient cannot be suggested an IVF. So, finally, I would like to tell you that each patient should decide on the treatment, understanding the importance of each and relevance of each treatment, and decide with your doctor as a combined decision so that you can achieve your dream of parenthood at the earliest. Thank you. Any questions? So the question I've been asked is, why is IUI less successful than IVF? Yeah, like I already explained to you, IUI is just an assistance of natural conception. See, when you're having sexual activity, the sperms are deposited in the vagina and they travel to the whole of the uterine cavity and meet the egg inside the tube. But what we are doing in IUI is we are just bypassing that whole travel process for the sperm. We are making, the work easy for the sperm, and we are depositing it into the uterus. So we don't really know whether the sperm is able to meet the egg or no, whether they are able to fertilize each other or no is a question mark. So IUI is basically a very much blind procedure which is bypassed in IVF. In IVF, all the work that happens to form an embryo happens in the lab. So the only thing that has to be decided is once you place the embryos inside the uterus, whether it gets implanted in the uterus or no is all that is important. So that's the reason why the success rate is really different. So after IVF procedure, is bed rest needed? Many patients have this doubt as whether after embryos are placed, should they move or no? Should they turn to one side or no? Absolutely no. Okay, they also have this doubt that if I get up and walk around, the embryos are going to fall down. No. So once we place the embryos inside, the cervix is a structure which can hold many things inside. Don't worry, you don't need complete bed rest at all. Definitely you have to monitor your physical activity. You cannot start running around or jogging after an embryo transfer, yes, but you don't need to take bed rest. Is IVF procedure painful? So IVF procedure is painful in terms of how you take it. Okay, if you are scared of injections every day, then yeah, you might find it painful. But no, injections is the all the little pinprick that you will feel, and the egg pickup procedure, like I told you, is done under mild sedation. So you will not really feel any pain. Once the eggs are removed, you are not going to feel any pain. And later for embryo transfer also, as I mentioned, it's like an IUI procedure wherein a very thin catheter is loaded with your embryos and the embryos are placed inside under ultrasound guidance. So IUI procedure as such is not really painful. Can sperms fall out after an IUI? So this is also a very valid question which many of my patients ask, that after IUI, sometimes they feel some kind of wetness when they get up and go. So that is not the sperms. So basically what we are doing when we are doing the IUI is we are inserting the catheter inside your cervix. So when we do that, the mucus in the cervix may get dislodged. So that is the time that mucus may come out, and some vaginal secretions may come out, which make you feel that wetness. So the sperms generally don't come out. In fact, the moment they are placed, it has been seen in studies that sperms reach the tubes very fast. In less than 2 seconds, also the sperms may reach, because they are that actively motile. What are the charges of diagnostic laparoscopy for infertility? So, di- first thing I would like to answer this question in a different way, that diagnostic laparoscopy has very limited indications. I would never recommend a laparoscopy only to diagnose what the problem is. No, people who need laparoscopy should be having some disease already. That is, if they are having mild to moderate to severe endometriosis, which can already be picked up on ultrasound. Okay, and if they are having, if they have, we have already tried lot of treatment in them, having polycystic ovaries, and they are unable to respond to our medications and drugs, which is also very rare. In fact, in my practice, I have very rarely seen PCO patients also not responding to medication. So only those patients are the ones who may need laparoscopy. So diagnosing infertility by laparoscopy is not the right thing to be done. Yeah, but if you want to know the cost, it can vary depending on your condition. Okay. So if you have a fibroid, and the fibroid is beside the uterus and it is nowhere interfering your endometrium. Endometrium refers to the lining of the uterus. So if that fibroid is not, interfering in any way of your conception, doesn't disturb your tubes, doesn't disturb your endometrium, then you can go for any treatment depending on your condition and how your doctor suggests. If there is no other problem with your ovulation, or your husband's sperms are perfectly fine, you can go for an IUI treatment also. But if you have already tried multiple treatments, you have already tried IUI, then probably IVF should be an option. But fibroid per se is not a thing to decide whether you should go for IUI or IVF. A fibroid which is away from the uterus doesn't need any kind of uh, treatment as such. Where we get pain while implantation of embryo. During implantation, some patients after embryo transfer or even after IUI do complain of some kind of discomfort or some crampy feeling in their lower abdomen. Some patients may even have some kind of spotting. This may be to a certain extent good sign, wherein there may be chances of implantation. But it is not a general rule that you will have pain or you will have spotting after implantation. If anyone has cyst in the ovary, still can the couple go for IUI? Yeah. So if there is cyst in the ovary, it depends. If the cyst is very small, somewhere like less than 15 probably you can continue for the IUI treatment. But if the cyst is large and it is functional, By functional, I mean that cyst is also producing hormones which can be tested by your doctor by doing certain hormone tests. And if that cyst is functional, then it is better that you take some treatment to for the cyst to regress and then plan your IUI cycle. So the functional cysts are different from cysts which can be tumor cyst also. There are certain cysts which can be tumor cysts also, which are large, which are more than 5 centimeters. But functional cysts are generally not larger than 2 to 3 centimeters. So those cysts can come down with tablets also. But if there are larger cysts which may be tumor cysts, they need evaluation, they may need surgery also. How we can find our IVF is successful? Okay. So, like I told you, the success rates of IVF difference, and how you can decide whether your IVF is going to be successful or no is first thing. You are going to have a positive attitude that things are going to work well with you. Have faith in your doctor completely. Okay. And what you can do to make your IVF success best is that adopt a very healthy lifestyle, have a very stress free life. Okay, it's very easy for me to talk. I totally agree. Very difficult for you to practice, but yes, you can. Practice some kind of holistic medicine like yoga or some kind of meditation which gives you a total calmness inside your body. When that is when your gametes are also going to be healthy. So that is the next thing. The fourth thing that you should consider is that your oocyte and sperm quality. Like I already discussed, once you go for an IVF procedure, your doctor is going to step by step tell you right from the day one, how your response of injections is, how your follicles are growing, how your blood levels are correlating with your responses, how your eggs are coming. Okay, and once the eggs are removed, what is the quality of the eggs? Once the sperms are injected, what is the quality of the embryo? How your endometrial lining or your endometrium is developing? So all these factors define your success rates. So just don't get confused. Believe me, if you have the positive attitude, I have seen miracles happening. I have seen, when science doesn't permit, at such a situation also I have seen that patients have conceived just by their positive willpower. So I would suggest that you keep up your hopes and keep your positive attitude. How long a washed sperm will live? Okay, so like we decided that in an IUI, the sperms are washed and prepared using media. So generally, the washed sperm can be active for about 6 to 12 hours. Okay, but sometimes the sperms have seemed to be active even up to 24 to 48 hours. So that is the reason why many gynecologists prefer to advise their patients to have sexual activity in the subsequent 2 to 3 days, so that you cover the period of ovulation. 4 IUIs and 2 IVF cycle failed. What next, doctor? Okay. So, if you had 2 IVF failed cycles, what you need to see is that why those IVF cycles have failed. Is there anything that can be changed? Is there anything with the quality of the egg that is a problem, or the quality of the embryo, or is there some mismatch in the timing of the embryos being implanted? Okay, so probably for in your case, we may have to do something like a PGTA, like I mentioned, since you have had 2 failed IVF cycles, you fall into a category of recurrent implantation failure. So we may have to reassess how your uterus is, a 3D scan of your uterus to see if there's anything. And a hysteroscopy would be really ideal, because there are certain things which cannot be told by scan also, something like micropolyps or some small adhesions inside your uterus which is not letting the embryos implant. So that could be one thing we can do. And the other thing is, we may require a PGT for you to find out if your embryos are genetically good and strong enough to implant into your uterus. So probably these are the two things that you can look into next time. Of course, I'm sure you would have undergone a battery of tests to find out why things didn't work out with you. But I think an hysteroscopy and PGT would be the good option for you to consider next. What should be the endometrium size for IVF success? Okay, so the endometrium size generally is expected to be around 8 mm is the ideal size, but people with 7 mm have also conceived. So anything above 7 mm is good enough, but more than size, what I look into is the endometrial pattern. What is the vascularity? What is the blood flow of the endometrium? Okay, how it looks in scan is what is more important than just size. There are different parameters that we consider, and size is a very minimal parameter that is considered. Because I have seen patients who have conceived even with 5.56 mm. So size is not the only criteria to consider in IVF. So I think this question we already discussed. And thank you so much for attending this Facebook Live session, friends. If you have any doubts, I would like you to approach us so that we can help you out in the best way, so that you can achieve this, little joy of being a mother and father as soon as possible. Thank you so much, friends.